Jesus, all the way. I'll forever trust in you. Jesus, all the way.
JC 24/7.
I am told that some people are on good behavior simply because of poor health practices. In other words, we tend to live right because we have not been living right. One of the results of poor health practices is something called cancer. Yes, that dreaded disease. It seems to be a disease that we cannot live with, and yet one that we cannot live without. Or can we? Well, we have invited and set here two RNs, or registered nurses, who are going to help us in this discussion as we introduce this whole question of cancer, its cause, prevention, and treatment. Welcome to my panelists as we enter into this very, very sensitive area of cancer. And I want to maybe begin with you, Miss Anne-Marie Jackman, as you help us understand what is cancer.
Cancer is considered a abnormal growth of cells in the body. Now, our bodies, the cells divide under a very tightly controlled mechanism. When that mechanism is defective, you find there's an uncontrolled growth of cells, and that is what leads to cancer, the formation of cancer.
Okay, so when that, so it's caused because, so we're always susceptible to cancer then?
Yes.
From since birth?
From birth.
Oh, okay. So the longer we live without cancer, it's a testimony to how good our practices or lifestyle might have been. Perhaps. Okay. How prevalent is cancer in Trinidad and maybe some parts of the Caribbean?
Well, cancer is the third leading cause of death in Trinidad and Tobago. The first would be heart problems.
Okay.
Right? So cancer is the third leading cause of death in Trinidad and Tobago. As a matter of fact, worldwide, it is also, very high in the mortality rates.
Okay. Does cancer have a preference in terms of its victims? Ethnicity, race, color, creed, I don't know. Does it have a preference for certain types of persons or individuals?
Well, the most obvious factors, right, that are associated with cancer is a lack of proper health care, right? It also has to do with some of our socioeconomic factors, lifestyle, work environments and things like that.
Okay.
If you work in an environment that, allows like people working with asbestos and things like that.
Okay.
Even secondhand smoke.
Good.
Right?
No, and I'm going to come back to the question, but secondhand smoke, how dangerous is that as opposed to the smoker? Is it more dangerous than the person who's smoking?
I would say it's more dangerous because you are getting the direct fumes from the person who is doing the smoking. Because when they smoke and they let out, it comes directly onto you.
Okay. So you could be killing me because of your lifestyle.
Yes, you can be.
A dangerous place in which to be. But in terms of race, does cancer affect certain types of persons relative to their race more than others?
Well, from the evidence, they have shown that African men more or less they are more prone to prostate cancer.
Okay.
So that's one of the risk factors of prostate cancer.
Okay.
We have seen that colon cancer tends to, I wouldn't say choose,
I hear you.
choose its persons, but if you have a very poor diet or a diet that is high in fats or high in low fiber, white foods as we call them, they tend to more have colon cancer.
Okay. Why are African men susceptible to prostate more than other types of men, so to speak?
The genetic composition of the African male, so they tend to be more prone to prostate cancer.
Okay. What about age groups? So all age groups be concerned about being infected with cancer, or does cancer affect certain persons of a certain age group alone?
Well, all age groups are affected by cancer, right? Because you have a lot of time when we talk about cancer, we talk about men and women, and we forget the children. But the children are also affected by cancer. So blood-related types of cancer,
Okay.
more than organ types.
Okay.
Right?
Therefore, we cannot say that all types of cancer are related to lifestyle. Because if a child is infected, is it that his lifestyle led him to be infected with cancer?
No, I guess you'll be more looking at genetics there.
Right.
More gene
Okay.
passed on from
So
family
some
members.
cancers are
So some
genetically
yeah, some are
Yes.
genetics.
passed on. Is there a specific age group that is most vulnerable? Like over 40s, 30 to 40, 20 to 30. Is there a specific age group that we must now become truly concerned about?
Well, okay, for example, you have older men would tend to get like prostate cancer.
Right.
While the younger age group, say 20 to 39, they would tend to get more like testicular cancer.
Okay.
Right?
Right.
In the under 15s, you would have things like leukemia would be most common with them.
Okay.
Right? And as you get older, getting cancer increases, and the
Right.
more vulnerable age groups are those 50 and above.
Okay. We will be dealing with prostate cancer in another segment, but I just wanted to be sure. At what age we said older men? What older in your mind mean that are susceptible to prostate?
50 and over.
50 and above. All right. Could you identify some of the major forms of cancer that we are mostly affected by these days?
Well, you see a lot of breast cancers, prostate, colon cancers, and cervical.
Okay.
Yeah, there's a huge increase of it,
Okay.
especially within recent times.
Okay.
You see persons coming down more with these types of cancers.
Okay. Do men get breast cancer?
Yes, they do. Once you have breast tissue, you're
Okay.
prone to cancer. They do not get it it's not as prevalent in men as it is in women, but they do get breast cancer.
And how can we determine whether cancer is present in the person? Because I understand in some cases it's a silent killer. It's like the body's termites. Are there signs, are there symptoms we must be looking out for to help us at least be able to trace that there is some kind of cancer in our system?
Well, I guess different types of cancer you would be able to detect, like a symptom or something is wrong.
Right.
In terms of breast cancer, you might feel a lump.
Right.
In terms of lung cancer, you might have difficulty breathing, you might cough up blood. In terms of colon, you might have problems with elimination, so you might have constipation or diarrhea.
Okay.
But other cancers are very insidious. They might be there for a while, and it's only when it's really grown or has become a problem that you find out. And sometimes it's late stage.
Okay.
So it's very
So what advice would you give somebody? I mean, if we are, I could be talking to you and be infected with cancer, what kind of advice would you give the average person in helping him to be wary of the presence of cancer in his body?
Well, it is difficult to say, that you can do this or you can do that,
Right.
to know that you have cancer.
Right.
Right? Now, there are some things, like, for example, breast cancer. Women can do their own self-breast examination.
Okay.
They can go have mammograms done. Right? For the men, you can have the DRE, which I know that men, for some reason, hate.
Yes, and we'll come to that in another segment.
You can have these types of things that can help you to determine whether you have, one type of cancer or the other.
Okay.
And also with the women, if they have a family history, right, of breast cancer, particularly if the mother, grandmother, aunt or sister may have had breast cancer, they can go and have the BRCA test done to determine if they are also,
So is it sufficient if I were to take a yearly checkup, for instance? That would not necessarily help me to determine whether there's cancer. I leave the doctor with a good bill of health, maybe, and I'm thinking, well, hey, I'm free of cancer. Is it safe to say that?
Well, for most times an annual checkup would always indicate that something may be wrong.
Okay.
Right? Unless, as we heard just now, that some of them are, you don't get any kinds of indications at all until it is too late.
Okay.
right? But an annual checkup would always give some kind of indication that something is happening.
Are all forms of cancer a death sentence? Should we treat every form of cancer as a death sentence?
Well, it's based on the frequency of the diagnosis and also the gender, right? We can't say that it's a death sentence because it is also your lifestyle that would have to deal with it. Because if you do the things that you are supposed to do, right? Eat the types of foods you're supposed to eat. Now, as was mentioned just now, some of the cancers that we see deal with the types of food that people eat, a lot of flour and things like that, right? Fats and so, right? But if we eat more fiber foods.
Could you give me an example of fiber foods?
A lot of beans, vegetables, right?
Are fruits considered to be fiber food?
Yes, you have a lot of fiber in fruits. Right? A lot of fruits and vegetables, beans and so. If we get rid of some of all the meats and so that we like to eat, that has a lot of fat and so in them, then, and also exercise plays an important part in our lifestyle. 75% of our bodies consist of water. And if we drink, as a matter of fact, you should drink at least 1/3 of your weight in water every day. For example, if you weigh 150 pounds, you should be drinking at least 50 ounces of water every day, because water helps to cleanse the system and cleanse all the organs out. If you wait until you feel thirsty, that's the wrong time to drink the water, because it means then that your brain is dehydrated.
That's a very interesting notation you make there. It's about drinking 1/3 of your body's weight. It's interesting because, you know, we have been told that very often we must drink 6 to 8 glasses, but it depends on how big the glasses are, I'm sure.
Of course.
We are looking at cancer, its cause, treatment, and prevention. When we come back, we look specifically at the treatment. Stay tuned. We'll be right back.
I'll forever trust in you. Jesus all the way.
JC 24/7.
Lights appearing through a window, blurred with rain. Emotions run together in a flood of doubts and pain. We prayed as best we can. Now we must leave it in His hands. And yet I know when my eyes fail to see, He is able. And even though it seemed impossible to me, oh, my God is able. For if He chooses not to move in the way we prayed He would, be confident He's working altogether for my good. I will stand behind His word, for He's able. Questions seems to haunt you night and day. You say, how can God allow your heart to be torn this way? Does He listen when you call? Is He even there at all? And yet I know when my eyes fail to see, He is able. And even though it seems impossible to you, He is able. But if He chooses not to move in the way you prayed He would, be confident He's working altogether for your good. I will stand behind His word, for He's able. He's able. And as the night gives way to dawning and evaporates away, I'll stand to face another day. I will stand behind God's word, for He's able.
Forever trust in you. Jesus all the way.
Welcome back to our discussion on cancer, its cause, treatment, and prevention. Well, prevention or treatment, depending how you look at it. And when we took the break, or just before we took the break, Mrs. Boyce Crooks, we were asking the question about whether all forms of cancer are a death sentence. And little did I know that I was asking the right person the question, because you yourself are a cancer survivor.
Yes, I
Could
am.
you tell us something about that experience?
Well, I developed cervical cancer some years ago. I had treatment for it. I also used what we call natural medicine, because I was reading in the Back to Eden book about certain things that you could use, and I used that, and it helped. I did not have things like chemotherapy, and so
Okay.
I had surgery, and I use what I saw in the Back to Eden. I still do use it
Okay.
up to now. And just about 2 weeks ago, I had some blood works done, and I was told that in all the people who have ever been to this place to have bloods done, they had never seen any blood looking like mine, so perfect. The
Have
cells
mercy.
were almost perfect. They couldn't even understand that I had cancer before.
Okay. Now, this is 2013. How long ago are we talking
This
about?
was 1987, 1988.
Oh, my goodness. Praise God for that. You don't even look the part. Not that cancer has a look in any way, but thank God for the way you have been recovering, or at least you have recovered from it. Speaking of treatment, what are the various types of treatment, and are they reliable, in your estimation, and affordable at the same time?
There are two different main types of treatment. We look at chemotherapy, which is more systemic. So it's like getting drips.
Right.
So they put the substance into your veins and it goes to the bloodstream, and it would target the cancer cells, not only the cancer cells, but your normal cells, which is why you have the side effects.
Okay.
Then there is radiation treatment, which is more localized. So they would locate the area that the cancer is, and they would give you the radiation on that area.
Okay.
Some of the side effects, you might have nausea, you might have vomiting,
Okay.
you might feel a bit tired because of your other cells being destroyed.
Okay.
But another important part too is based on where the cancer is. For
Okay.
example, let's say head and neck.
Right.
Because the radiation is there, you find it will affect your swallowing reflex.
Okay.
So you may not be able to eat normally, so you will find you lose weight. You might have to have a tube in your stomach to get nutrition otherwise. So those are the two main types of
What determines
treatment.
which type is used? What is it that we would determine, or what would use to determine whether you get radiation or chemotherapy?
What determines that is the stage of your cancer. So
Okay.
let's say, for example, cancer has 4 stages. you come in with stage 1 and 2, and there's no spread, right? Because normally the cancer would spread via your lymph nodes.
Okay.
And your lymph nodes are located in places where you can feel them. So when you go to your doctor, they would palpate, what we call palpate, which is more or less feeling the area. Once they establish there's a lymph node that is infected,
Right.
it means it would have gone to other areas of the body.
Okay.
So then they would have to treat you with chemotherapy in order to target those areas.
Okay.
If it's just stage 1, where there's a lump probably and there's no spread,
Okay.
they would look at radiation.
Okay.
Mind you though, some patients do have radiation plus chemotherapy, based on how large the cancer
Okay.
is. They
And
have
how
to
many
do both.
bouts of chemotherapy do we have? Or is it one time, once and for all?
Well, it can be one time because what happened, as I said before, the chemotherapy cannot tell exactly what's a cancer cell from what's a normal cell. So you have to do it like every 3 weeks,
Right.
to give your body time to recover,
Okay.
the other cells to grow.
Right.
So, and you find it will target the fast-growing cells in your body, like your hair, those that line your stomach and your esophagus.
Okay.
So you would have the nausea, you will have the vomiting. So they cannot give you right away. I mean, the treatment alone will kill you if you have
Okay.
it directly.
Okay,
So there
okay.
must be a break.
You say every 3 to 4 weeks. For how long? Is how many times, or is it we estimate that it's going to be 3 bouts, 4 bouts, or is there a limit?
Well, they look at the cancer itself too. So certain cancers, we have regimes, we call them.
Okay.
So whereas with breast, you may need 6 cycles of the particular cancer.
Okay.
Whereas colon, you might need 8.
Wow.
Or, so it varies on the cancer
Right.
that will determine the cycles of chemotherapy that you would get. Or the radiation too.
Does radiation or chemotherapy encourage the spread of cancer?
It doesn't encourage it, but it could lead to a secondary cancer.
Okay.
Which is one of the complications of the treatment itself. They might be treating you for one, but the treatment itself could cause another cancer.
Let's come to good news, right? Herbal treatment. I've heard people say, well, we can use herbal medicine to treat with cancer. What is your take on it?
There are several herbal remedies that may lower or, cause, be used for treating cancer. But actually, it's the things that you eat. Because a lot of our, if you want to call them herbal treatment, it's the things that you eat, right? And as was mentioned before, if you eat a lot of fiber foods, get rid of a lot of the fat foods that we eat, right? A lot of fiber foods. You have vegetables and things like that. Now, from ever since I could remember, always love fruits and vegetables. I would prefer to eat a salad than to eat cooked food.
Wow.
And I always have people asking me, that's all you eating? But it's what I enjoy.
Okay.
And I guess this is part of because this is what I was told to because of the type of meals that I eat,
Right.
that I have not had a reoccurrence of the cancer.
What stage was it, by the way?
It was in the early
Early
stages.
stage, okay.
Because I had started having a problem, and from the time I noticed the problem,
Right.
I went to the doctor and had it dealt with.
Okay. Would you recommend raw food as part of your diet?
Yes, I would, because if you take a seed and you cook it and then plant it, would it grow?
Not at all.
Well, exactly. So then, if you just plant the seed is going to germinate and grow.
Right.
So if you take the foods, particularly if you can juice them, you get everything out of the food in the juice. And it is much better because you don't have to masticate the things now to give you all that added work. This is absorbed one time as it goes into the stomach and goes through the system.
Right.
It is absorbed,
Right.
and all the nutrients are absorbed one time.
Okay. I think I know the answer to this question, Ms. Jackman, but I'm going to be asking you again. Can cancer be prevented?
Yes. there are certain risk factors that could lead to cancer that once you avoid them, it reduces your risk of it. Now, if you have a genetic disposition, it could be a bit more difficult. But in terms of lifestyle, like what you eat, how you live, if you smoke and drink, if you're promiscuous, if you work in environmental, if your jobs, deals with chemicals and things that could predispose you to it, then if you eradicate some of those, then you could reduce the risk of developing cancer.
Okay. And I suspect, well, you have championed the cause of drinking lots of water as well. Exercise could also be a critical part of it.
Yes.
So every time we are alive without cancer, it could be a testimony, as I said earlier, that we have been doing the right things, maybe to some extent, or we have gotten away, some people might say. As we begin to wind up, what is, in your estimation, the role of prayer in the treatment of cancer? How vital did that prayer play in your life, Sis Brooke?
Well, prayer represents an important part in your coping strategies for anything, right? Regardless of whether it's cancer, even in your daily life, prayer represents an important coping mechanism in your life.
Right.
So you need to pray. Research now is being done as to what prayer does when people are ill. And they have found that the people, particularly ones who go to church a lot, right, and they have support groups,
Right.
the prayer helps them a lot with whatever illness it may be.
Okay.
Right? Then you have the physical changes in the body, right? Where prayer and meditation keeps you calm, calms you down, gets rid of any depression that you may tend to come up with,
Right.
eases the stresses of life, and so.
And not to cut you, I understand that cancer could also be stress-related. Is there some measure of stress? Could stress
There
bring on
is
cancer?
research that shows that cancer can be stress-related as
Right.
well.
So prayer could keep you at ease and reduce the stress level.
Yes, it does.
All right. Finally, can God heal cancer? All forms of cancer. Miss Jackman, help us. Does God really heal it, or is it that we just got away? We were lucky. Mrs. Boyce Crooks says she has been a survivor for many years. Is it just by chance? Is she a case of misfortune or fortune, or is it that God did play a part in healing cancer?
Of course, God plays a part in healing cancer. In fact, the question you ask about a death sentence, a patient will tell you when they go and they hear that they have cancer, ultimately they think of death.
That's right.
Prayer is very important
Sure.
because you have to help them now cope and have a very positive mindset. You find a lot of persons who know God
Right.
or who have a relationship with God
Right.
tends to go through their period of the cancer and treatment a lot more successful
I hear
than
you.
those who don't really have that meaningful relationship with God.
Okay.
And of course, God heals. I have heard of persons who have gone to God, they didn't want the treatment, and God did heal them.
Right.
I think God could heal any disease actually,
That's right. Okay.
including cancer.
Okay. And even if God doesn't heal you, it doesn't mean that He doesn't have the power. Because the role of prayer, in my estimation, is not just to treat cancer, but to treat you
Yes, definitely.
with the cancer.
Yes.
Thank you for joining us today. Remember, it's not how long you live, but how you live that matters to God. Eat well, exercise a lot, drink lots of water, get back to the natural diet, and you will have a better chance of not only living long, but living healthily and also living for Jesus. Thank you for joining us. We look forward as we continue our discussion on cancer, its cause, treatment, and prevention.